gentlemen, welcome back to Doc Talk Podcast. I'm your host, Dr. MJ, and the co-host, Dr. AJ. AJ, can you get off your phone?
Did you just call me the co-host?
You're kind of a co-host. I'm the main host. You're a co-host.
Oh, is that what we're doing
Is that
now?
a sensitive?
Wow.
No.
Wow.
No, actually, we're co-hosting. Is that good?
A little bit better.
So, I mean, does the older brother have to always get his way? Like, is it just like a
yeah.
no thing?
Yeah, it is.
Okay.
Yeah, it is.
How you been, man?
I'm good. How you doing, brother?
Good to see you.
Chilling. I'm chilling, bro. Chilling. Life is good.
Well, life is good, man. Everything's been great. The podcast is taking off, and
I'm
we
really
appreciate
happy.
all the followers and all the love we've been getting. And the shirts have been out. All the girls look great in it.
Yep. We still have a few more people.
A few more people are
going to
post.
pictures.
So,
Yep. They just got their
and
t-shirts.
we're working on the next giveaway. So for everybody else asking, we're gonna get some more t-shirts. People kind of wanted the black t-shirts.
I was just about to say that.
So we'll get some black t-shirts and some other things. And if there's something that you guys want us to do with the giveaway, let us know. We're more than happy to do it. But today's topic is dementia. So it's kind of a topic that a lot of patients have been asking about. People don't really know about it. Actually, I had a few friends that are dealing with their grandparents and parents and stuff like that are dealing with dementia, don't know what to do, don't know what to look out for. And I think it's an important topic to talk about.
It is. Unfortunately, a lot of people suffer through it as well. And predominantly in our patient population, typically our average age is 65 years and older. Of the patient that we deal with, and I've had tons of patients with dementia. Unfortunately,
so hard. Honestly, I would say one of the most depressing things.
It really is.
I just wanted to tell you a quick story. We always tell stories on this thing.
Actually, you always tell the stories.
Well, I love telling stories. I'm sorry, but
yeah, it's okay. Tell the story, Dr. MJ.
Stories.
Tell the story, Dr. MJ.
Okay. So when I was younger, I worked at a nursing home, a Polish nursing home. Okay.
Yeah.
And I had a patient every day that would teach me Polish.
Yeah.
Dzień dobry, jak się masz, ja cię kocham, ja się jedem, aż lubię. So like these are some words that they taught me. And every day she would sing a song for me in Polish.
Yeah.
And she would hug me and she showed me so much love. And I really loved going to that nursing home. And I was young. I didn't know she had dementia. One day her family walks in and I want to kind of like show off how much I loved her. And I was like, hey, so good to see you. And she pushes me off. Get away from me. Why are you touching me? She like freaks out. And that whole day she would not talk to me. She would push me away. And it like really mentally affected me that I was like, wow, like somebody that loves you, that shows you so much love. Can you imagine your own mom or dad that raised you their whole life, don't know who you are? It's very difficult.
That's terrifying.
And today we're going to try our best to talk about, what is dementia, some risk factors, some things that you can do to help improve it, signs to look out for, and kind of different types of dementia out there. Okay. So first of all, let's start with what is dementia? Okay.
Well, typically it's basically changes in your brain.
Yeah, neurological condition that affects the brain.
Exactly, and your brain cells, your neurons.
Yeah.
And it causes different, symptoms with different patients. And there's also different types of dementia that we also have to mention in a little bit. And of course, there's always risk factors, right? So the most common one is age. The older you are, the higher risk of dementia.
Believe it or not, females are more prone than males to get dementia, which is weird because males are always we always die sooner. Everything happens to us.
It's unfortunate, but it's statistics show that it's more female predominant than male. Age again plays a role.
Genetic. That's my hardest thing because imagine being an athlete, don't smoke, eat right, do everything perfect, and then end up with dementia.
Sometimes you got no control of it.
Know your family history. That way you know, and that way you can kind of prepare. I mean, you can't really fully prepare for it, but just as much as you can. Cigarette smoking.
Yep.
Those are one of the things.
Alcoholism, drug use,
drugs,
marijuana. Bad stuff.
Also, injuries. That was a big thing.
Yeah.
That
traumatic brain injuries.
Traumatic brain injuries.
Yep.
So like when we talk about wear helmets.
Yeah.
Like I never, like when I was a kid, I was like, why would I wear a helmet? But like I'm seeing a lot of the older patients, if you talk to them, they'll tell you they fell off of a bike. They fell off of a ladder. They fell off something, hit their head, some kind of traumatic injury that caused
concussions,
deterioration of their brain.
Exactly.
And let's talk about some types. Okay. So we talked about the risk factors. So if you have those risk factors, like if you're a smoker, you're a drinker, if you hate dementia and you're scared of it, this is the time to kind of get away from that.
Exactly.
Types of dementia. So the most common one that we always talk about is Alzheimer's.
Yeah.
Okay. Alzheimer's is a very common one. And it's usually associated with an abnormal protein in the brain. Yep. I don't want to get too deep because I don't want to get everyone bored. But it's different than the other ones. You
Yeah.
know, it's the most common that you see.
It is the most common. It is the most
And
common, and it's pretty bad, honestly. It gets pretty bad,
there's
and it
three
gets worse with
stages:
age.
early, middle, and late.
Yep.
And so you kind of have to stage it. And it's kind of hard to stage it, but
Yeah,
you know,
yeah.
knowing early stages can kind of help. But remember, we really don't have like a cure for this.
Yeah.
So prevention is everything. What we do with these medications is try to stabilize it to make sure it doesn't get worse.
Yeah.
And one of the things I want to talk to you about, AJ, before you jump into dementia, again, I wanted to tell another story. One more
Another
story.
one?
Sorry, last one.
Okay.
Not last one. I can't promise that. But I had an intern. Okay, she came in. She saw a patient, and the patient was going out walking in the street naked, and family was like, "We need a nursing home." And then within 3 days, imagine this: within 3 days, they decided he needed a nursing home. He's demented. They want to put him on medication. So she comes to me. She's like, "Hey, I want to start him on dementia medication." And I'm like, "Wait. Slow down. The guy was just normal a week
Yeah,
ago.
exactly.
You don't get dementia that fast. There's
Yeah.
stages that you have to go through." We did a full workup. The guy ended up having a urinary tract infection, which caused him to be, confused, hallucinating,
Yes. See,
having
that's
these
a good
signs of
story.
dementia. So the reason I'm saying this is don't jump to dementia without doing everything else to rule it out.
I agree. That's actually a very good
because
point.
it happened, and I told her, don't you ever,
Especially in
jump to
our
that.
patient population. I mean,
Yeah,
UTIs.
don't jump to
the
it.
majority of them are UTIs.
Yeah, they can have an infection. They can have something else going on.
Yep.
One of the ones that like really is a soft spot because I've seen somebody go through it and it's really hard is frontal temporal dementia.
Yeah.
Frontal lobe. Anytime you get a frontal lobe dementia, you know that, right?
100%.
You hear stories about that.
Personality issues,
I
yep.
worked in a nursing home and this guy for some reason loved peeing on the trees. So every day I go there and his name is Bob.
Yeah.
And you go there and he's like, "Bob, you're peeing in the tree again," And
Yeah.
it's the same thing. When that frontal lobe goes, you really can't make the right decisions. Not
Yeah.
only are you forgetting, there's no inhibition, right? So like if you see somebody overweight, you call it fat. You know, like
automatic.
or like you see something and your filter system
Yep.
is like saying don't say it. He doesn't have that.
Yeah, he doesn't have that filtration process, unfortunately.
And so that one is really, but it's not very common to be honest with you. It occurs in usually 60 or above. It's rare to see it under 60. The next one is Lewy body dementia.
Yeah, that mimics Parkinson's. There's a lot of signs and symptoms. I mean, that combination of Parkinson's and Lewy body dementia too. You'll get that, the effects of the posture effects, trouble walking, etc.
Yeah.
The
Mask-like
the mask-like features,
Yeah.
exactly. So it mimics that a lot, but it also comes
It's
down.
that part in the brain that affects both of them. You know.
Yes, exactly.
And so if you do have Parkinson-like symptoms and you start developing memory issues, usually that's the one that you go with. But again,
Exactly.
a lot of these, especially with like Parkinson's, is diagnosed off of a physical exam. There's
Yeah.
not really too much testing to do for it.
It really isn't.
And dementia is a little bit harder because you can
Yeah.
do things like CBC, CMP, CTs, MRIs,
Exactly.
all of these things
All
to
of them.
rule out.
Yeah, exactly. And you look at like cerebral atrophy and stuff like that.
Make
and-
sure you don't
or
have a mass in your
the
brain.
mass,
Yeah.
exactly. Definitely. It's. I don't think it's an obligation to get imaging because I feel like certain symptoms could. You can just diagnose a patient with dementia just by doing a mini mental state exam, for
Agreed.
example. You
Agreed.
know what I'm saying?
That's one of the first things you do.
Yeah, so you don't have to expose the patient to so much radiation from a CT scan and tell them something. I got a little bit of memory loss. Well, you know what? It's common in your age group.
How
you know?
many times do you do a mini mental status exam? So often,
All the time,
right?
all the time. And a lot of them pass it.
They pass it, and you tell them, "Hey, this is a baseline," so that in 5 years from now, 2
Yeah.
years, 3 years, if
Exactly.
you're getting a 30 out of 30 now, and then you're getting an 18, there's a problem.
Yes.
There's a sign. Then that's when you do the workup.
Exactly. And then you look at the deterioration or the memory loss, right? How fast is it, right? Typically with Alzheimer's dementia, it's a little bit longer. It's a slowly progressive disease, right? Compared to like vascular dementia, where you're
the next
fine,
thing.
you're doing a little bit of memory loss, and then all of a sudden, 6 months down the road, you're like fully demented, and you're like, okay, what's going on? Well,
What is vascular dementia? First of all, explain it to the followers.
inflammation in the arteries, blockage in the arteries.
like
It's kind
strokes.
of like
Like
strokes.
people that have had
It's-
strokes.
It's basically a stroke.
So vascular,
if
right?
you had multiple strokes, your risk
Yeah.
of dementia increases automatically.
Like vascular blood, right?
Exactly.
And what is
Blood vessels.
While we're talking about this, like what is ischemia, right? So ischemia, basically, oxygen gets transported through blood, right?
Yep.
And when you transport the oxygen through blood, the blood needs to get to that part of the brain.
Exactly.
That's like watering a plant. It
Exactly.
needs
So
that
it
blood.
needs that flow, that good flow.
Yeah, ischemia is basically that oxygen is not getting to that tissue.
Yeah,
So when we
through-
say
for-
vascular ischemia,
Yeah, then that's what you're talking about.
So people
And-
have had strokes and all this.
Exactly. I always use the analogy of like a highway that's clear. You drive straightforward, everything looks good, and then you have like certain accidents that delays that oxygen transport, if that makes sense,
Yeah,
you know?
no, it makes
So
sense.
and that's what that type of ischemia is. It's just not getting the enough oxygen that it needs, you know? And over time, so for vascular, it's pretty quick, you know, and Alzheimer's
What are
is a
some
little bit
risk
more.
factors to that? Like, so like
Smokers.
if a patient came to you, has had multiple strokes and says, hey, you know, I'm doing fine now and still smoking. What are some things that you want to stay away from with that?
First of all, smoking, you said
It's
it.
like the biggest thing,
It's,
right?
it's obvious, right? Diabetics, right? Sedentary lifestyle, morbidly obese patients, high cholesterol. There's
High
so
blood
many
pressure,
factors and
yeah.
high blood pressure. There's so many
And things you
factors
can
to it.
avoid. Like, I would say, guys, vascular dementia, that's something that
It's very
you
common.
can prevent.
Absolutely.
Like,
You've
if it's
got
a genetic
control.
factor, that's different.
Yeah. Well, I mean, if you're already diagnosed with vascular dementia, it's pretty. I mean, you got it.
Yeah.
But if you have, if you're a smoker, if you're a diabetic, if you had multiple, strokes in the past, this is your time to have some lifestyle modifications and change your lifestyle.
100%.
Eat better. Exercise.
Blood
Don't
dude.
smoke. Don't drink.
I've done multiple studies on this, and one of the biggest factors is exercise.
Oh, that's
because
huge.
again, it's like
It's circulation.
imagine you have a plant.
Yeah.
If you don't water it, it's gonna die.
It's gonna die. Absolutely.
So you need to exercise to get some blood supply to the brain, because the brain, it needs to function. It needs oxygen, and
Yep.
oxygen is transported through blood.
Yep.
So that's one of the things I say. Patients, physical activity.
Yeah.
Make sure you increase your
Huge.
physical activity.
Huge. Number one.
Another thing I do is first thing when you wake up in the morning, eat, turn on your metabolism,
Yeah.
and do a crossword puzzle.
Yeah.
I have my
Good
patients, every single one of them do it,
Great
because
idea.
your brain is a muscle.
Yep.
If you exercise it, you got physical activity, you're agreeing in the blood, and
Exactly.
then doing the crossword puzzle to get some.
Exactly. If you want your biceps to be huge and big,
You
gotta
on it.
work on your biceps. You gotta
Yeah.
do some bicep curls, right? The brain is the same concept. It's a muscle. Work it.
And the famous
crossword puzzles,
thing-
Sudoku.
You know, the famous things that he loves giving for people for memory.
Yeah.
Almonds.
Yep. Dry almonds.
Yeah, soak them overnight, eat
Yep,
them in the morning.
exactly. 1 teaspoon of coconut oil.
Yep.
Right. And of course, turmeric.
Yep, exactly.
Turmeric,
That's
that's
he
his-
loves that. And
Yeah, I
studies have
use
shown
that
it
in my
works.
house all the time.
And
so.
with turmeric, obviously, just make sure you don't have any acid reflux or
Yeah.
stuff like that.
Of course.
Talk to your doctor
any
about
any
it.
of those three are okay.
Yeah, and talk to your doctor about it. But dementia, we don't have a cure for it, but there are some medications that can stabilize it. Like donepezil and all of these.
Yeah. And I think, honestly, from my personal standpoint, it's a 50-50. I've had patients that are on it that didn't help. I have patients that have helped slightly. And a lot of it is more mood stability than anything, if that makes sense,
Yeah.
you know? So it's more mood stability. And I only start it when when patients really start saying it's affecting the quality of my life.
Yeah.
You know what I'm saying? If you forget a phone number or a friend's name or something, it's not a big deal.
And there's a difference.
it happens to everybody.
Mind block.
Yeah, exactly.
I always tell patients, like, one of my patients told me, she's like, I went to a restaurant, my waiter came up, introduced himself, and I forgot his name. I'm getting dementia.
Yeah,
And I'm like, have you been anxious? And she's like, I've been extremely anxious. So I'm like, wait, time out. There's a difference. You're getting a mind block.
Yeah, exactly.
When you're anxious and your mind is running, you're not going to remember
you're
these
not gonna
little
remember.
things.
Absolutely.
But so one thing you can work on is scheduling.
Yep.
And that's what I feel like you're really good at that.
Yeah.
Schedule, organize, communicate with your family members.
Absolutely.
Schedule out your day.
Address book, use your phone, use
Yeah.
whatever it is,
Because they get
maps.
lost. How many patients do you know got lost going home?
Tons of them.
You know?
Tons of them. Unfortunately.
Unfortunately, yeah, they get lost
Yeah.
going home. And
But like I said, if this is bothering you, you need to work on it.
yeah.
You have to work on it. Start
And if
doing
you're
things
scared
different.
of it, don't be scared of it.
Yeah.
Face it.
Face it,
and,
exactly.
do the things that we talked
Yeah,
about
exactly.
to make sure you don't get it.
Follow those recommendations.
Yes.
It's not there's no magic wand, unfortunately, that'll fix it.
Agreed.
No magic pill, no matter what you try. Prevagen, donepezil, all these, on TV advertising. Oh, are you suffering from memory loss and dementia? Try our pill.
Not
It
gonna,
doesn't
like,
matter.
fix it and then your memory's
will
back.
not. It doesn't work like that.
Yeah.
But what we can guarantee is that you will become a lot sharper, and it can improve slightly if you work
Stabilize
on it.
it.
Just stabilize it
Never
so it
gonna
doesn't
get-
get worse.
Yeah, that's
so
it.
it doesn't get worse. If
That's
it's gonna
key.
get worse within 2 years, but you could extend it up to 3 years if you work on it. You see what I'm
Agreed,
saying?
agreed.
So that's all we can do.
Stabilizing it is everything.
It's all stabilization. So
And if there's something, if you have a family member going through this and you
Yep.
want to talk to us about it, let us know. Again, I say this in every video. Send us a message, comment, get involved in this. The
sure.
more you guys are involved in this, the more videos we do.
Yep.
And then that way we can be able to
Keep
take
going.
care of everybody,
I agree.
okay? That was
I
a great
agree.
topic.
I loved it,
and,
man. It was
and I
fun.
appreciate it.
Thanks, man.
Thanks, bud.
Nice to see you, brother.
You too, man.
Until next time, man.
Yes,
God
sir.
bless. Bye.